Welcome to OncoPharm. I'm your host, John Bazar. I am a professor of pharmacy practice at the supporting sponsor of OncoPharm, ETSU's Bill Gatton College of Pharmacy. It is 1st of February, 2026. I sound different. Got a little bit of a, I almost want to say it's a summer cold, but it's a winter cold. It's very much winter. Kids have been home from school all day this week. All day, every day, they've been home. So I'm recording from home from a different mic, and wanted to talk about chemotherapy education. And there are, probably in as many different ways to do a chemo education session as there are different types of cancer. One of the things, in my clinical practice has changed in the last, 15, 18 months, and I'm doing a lot more chemo education. And one of the things I found myself doing in these chemo education sessions is adopting some of what we at East Tennessee State University call the core communication skills. And so all of our students in the College of Pharmacy, College of Nursing, College of Medicine, they in their first year in those curricula, they take a class together called Interprofessional Communications, which I have facilitated. They're in small groups, and in these small groups, it meets for 3 hours every other week. They have modules to do on the in-between weeks. But in those 3 hours, you're together in a small group of like 7 people, including a facilitator, which I've done, and 6 or 7 students. You'll have a series of standardized patients come in, and the students interview the patients. And the point is about learning these core communication skills. And so I found myself using those core communication skills in my chemo education as much of a template of what I'm doing as the chemo education, the printed sheets we have, So sometimes if you're doing chemo education, you might go to Encoda or print out the medication guide from the website, but you print off some stuff and you kind of go through the list. That's what you're doing. You're going through what you're supposed to cover on that list. Some of you may have a template based on the ASCO or the ONS and HOPA oral chemo best practices. It has all kinds of stuff to go over. And if you look at these worksheets, going over the side effects is as much time as going over the storage as far as the lines of space, right? There's a lot to go over. If you do the core communication model, it's a little bit different. So there are 6 core communication skills. So the first is rapport building, then agenda setting, information management, active listening, which includes exploring the patient's perspective of illness, addressing feelings, and then common ground. And usually in the classroom or in these small groups when we're doing it, it's trying to get information from the patient and trying to figure out what's going on. It's a little bit different in a chemotherapy education because you are trying to convey information to a patient. But it is still very much a two-way process. And so I found that I use these core communication skills, and I have, for a couple of years, wanted to actually develop a series of videos and modules about how these core communication skills can be used in chemotherapy education. And to be honest, I'm out of ideas for a podcast this week because I've had to record a whole bunch of lectures from home instead of in person, and the kids are home. So I'm just going to give you some highlights here of how I've used these core communication skills in chemo education. So the first is rapport building. This is really important. The first time you meet someone is to try to figure out, try to find some common ground, something that is going to make them trust you and make them an engaged member or engaged patient in this communication. And there are a lot of different ways, that you can do this. Sometimes a little joke. Sometimes I like to ask people where they're from, and ask, "Oh, okay, well, I think I've been by there." Try to some lighthearted. It's not really small talk, but you're trying to establish some trust that this is not going to be a scary thing. And it's also really helpful for me to maybe ask, so what kind of work did you do, or do you do? If they come back and based on what their answer is, that can then affect how much depth I'm going to get into in talking about this. So that's rapport building, and that doesn't just happen at the beginning of the interview; it's all the way along. So if they tell me that they're, a mechanic, I'll try to use car analogies on throughout the chemo education. That also continues to build rapport. So that's the first thing, right? It's basically, you could summarize it as making a good impression, and being a partner for the patient in their treatment journey. The next one is agenda setting. And this is one that is really helpful that I use a whole lot. One of the things that I'll ask everybody when they come in, I'll say, this is what we're going to do today. This is what I want to do. I want to go over your medication. I want to talk about how you're going to take it, talk about the side effects. But before I go into that, what is it that you want to get out of this education session? And then that, sometimes that gives you an idea of what their level of health literacy is, what their level of maybe internal versus external locus of control is. Some of them are just like, I'm here because they told me to be here, or I really want to know about how this is going to affect, my ability to be active. I live on a farm. I do a lot of my own work with animals. I really want to see if I'm going to be able to do that, because if not, I need to start making some plans for that. So right away, that's helpful for me to know that I need to talk about that quite a bit with the patient, and being able to address those concerns also then helps build rapport. Another tidbit that I've learned in facilitating the communications course is something called a ubiquity statement. That is ubiquitous. It's something I say to everybody. And for me, I always, to try to get what they know about the drug, I say, these days it's so easy to just Google everything, or you get the AI summary. What have you, most people are going to look up about the drug they're going to take for the cancer. What have you learned about it? What have you read about it? And that gives me some idea too, because sometimes they come in with some misinformation. Sometimes they come in and, they have some stuff that they've looked into, and they've researched it quite a bit, and you can get into a little bit more in-depth discussion with those types of patients and those who are like, yeah, whatever, just tell me what to do, I'll do it. And then the bulk of the education session is looking on this third core communication skill, which is information management. Okay, so this is how you not only receive information but relay information. And there is, I think, an order to do this. One of the things that I am very frustrated, and what I found most challenging about chemo education, is the volume of material that you're expected to educate a patient on. It's more than is possible for a patient to understand in a 30 or 60-minute education session for a lot of drugs, especially the multi-kinase inhibitors have a gajillion side effects you'd want to cover. You can't conceivably cover all of them. You also have, for lack of a better word, some CYA things that you have to cover about how to store the medication, about what to do if you miss a dose, and these sort of things that are important. And often those things are written down, and I'll refer patients to the handout for those things, so I can spend more time on how to manage the diarrhea that's probably going to happen when you start your neratinib, that we know is going to happen. Because there's only so much that a patient can understand and take in during the session. And just as an educator, I know the more information you try to convey to a person per unit time, the lower the percentage of information they're going to get. It's a little bit like oral iron. The more oral iron you give to somebody, the lower percentage of oral iron they're going to absorb. And so it's trying to find that right mix of what you're going to say, and then how you're going to say, avoiding jargon, using simple terms. The printouts I use are the Encoda handouts on drugs for chemo education. I'll print those out for people, and I'll highlight the most important things. I oftentimes will go to, you can look up the percentage of people having a side effect with capecitabine, but what the patient's going to have is going to be different if they're getting single agent capecitabine or if they're getting Capox, for example. So I'll actually try to write down the percentages of side effects that people had on this particular regimen that they're on as well. So I focus a lot on that part of it, how, what side effects to expect, how to manage those. I try to put it in side effects that plan for, side effects that probably won't happen, side effects that are very scary that we need to know about right away. This also can be an element of rapport building, because I'll tell patients, I'll follow up with you, in a week or 2 weeks to see how you're doing, and I can make notes to myself about, make sure you follow about this, or there's this other side effect that, I really want to tell you about, but it's a side effect that doesn't show up for a couple weeks. And so I'll make sure to check in on that and talk about how to manage that maybe at a later date. But that's all information management. A big part of conveying this information leads me to the fourth core communication skill, which is active listening. So it's not just what the patient says, but their body language, their facial expressions. Are they understanding what you're saying? If you ever say, does that make sense to you? They're all going to say yes. So you don't just want to say yes. You want to ask, so tell me what that means, or tell me what you would do in this situation. That's a big part of active listening, which includes, what's the patient really understand, or what are they worried about? What are they thinking? What's their perspective of illness? that's a big part of it. A good way to do this is to ask them to explain back to you what they know versus just saying, does that make sense? Do you understand? Yes, they're going to say they understand. So oftentimes I will end the education by saying, okay, so tell me back, the most important things about this. What do you remember about the drug? And the one thing I tell them, if there's only one thing you know about this medication, it's how to take it when you go home, because it can't work, and it can't work safely unless you know how to take it, especially for drugs that have very specific requirements for food and how they take it. And then there's the fifth core communication skill is addressing feelings. And so in the example I used earlier of a patient who's really worried about how taking a drug is going to affect their activity level, you talk to them kind of one-on-one the way you would a loved one about potentially dealing with this toxicity, how this is going to affect their life. And sometimes it can be maybe the first time they really appreciate the impact of taking this drug is going to have. You can almost see in real time, patients will ask, so is this a drug that, I was doing a chemo education a couple weeks ago, and a patient and caregiver, and the caregiver said, so is this medication just for a little bit of time? Is this for like the rest of life? And it was in a metastatic setting. As a pathologist said, yes, this is going to be a medication that your loved one is going to take as long as it works, or until the side effects become too much. And that was kind of the first time that they appreciated that. And so you had to give them a little bit of time to sit with that, because it was kind of a realization. And so I let them sit with that and said, so what do you think about that? How does that make you feel? And they kind of had like just a matter of fact, well, it is what it is. We have to deal with it. And it didn't seem like they want to talk about it anymore, so we moved on. There are other times they really do want to talk about it. And that does bother them. And there are other people in our clinic that I can refer those folks to for more in-depth discussion about that. And then if there are, the sixth core communication skill is common ground. And so sometimes there is there's a disagreement. I've done chemo education before, like with abemaciclib, which is a tough drug to tolerate, where a patient had basically said, I don't think I want to take this. I've had this happen a couple times. The patient says, I don't want to take it. I've looked up some of the side effects. I've seen people in support groups talk about how they hate the drug. I don't want to take it. And I said, well, I didn't say you have to take it. That's not reaching common ground. I just kind of said, okay, well, what's your understanding of the benefit of the medication? And they knew what the benefit was. They knew what the risks were, and they clearly had made a decision. I said, well, okay, I understand that. Would it be okay with you if I call you in a couple weeks just to check in and see if you reconsider this? And they said, yeah, that would be fine. And I called and checked in and said, and they were still I was like, just think about it, and I'll call you back, see if you change your mind. And I called back, and they hadn't changed their mind. And I said, okay, well, if you ever have any questions, just feel to give me a call back. And I talked to the oncologist saying, this is what happened. This is why the patient's not doing this. It was their decision. And so sometimes you can't reach common ground. But what you don't want to do is leave that education session with the assumption that because you told the person it was important and how to take it, and you didn't give them a chance to talk about it, that they're going to take it, and they come back in for a follow-up visit, and everyone's thinking we're checking labs for LFTs to see if you're tolerating this drug that is potentially hepatotoxic. And it turns out they haven't taken it. Then you haven't done your job in chemo education. And there's a lot of nuance, of course, to this, and how this can play out with different types of patients, with different disease states, adjuvant, curative setting versus palliative and setting, as well as specifically talking about some of these side effects and supportive care strategies. That's beyond the scope of this short little 10-minute podcast. But that is kind of how I think about chemo education now, is from this structure of first agenda setting. What do you want to know? This is what I want you to know about this. When I've talked to, I've done education on a healthcare professional who's retired. And we talk about pharmacology because they're interested in it. And I don't do that for everybody, but for those folks I do, and that's another example of rapport building. So that is a little bit of some of these core communication skills and using them in chemo education on top of covering storage, administration, side effect management, making sure they have the phone number to call for side effects, how they're going to get refills, all the nuts and bolts stuff you have to go through as well. But thinking about it from the patient perspective as well, and trying to make it the most satisfying experience for all involved. Thank you so much for listening. You can follow me on X at FarmDeepNib and other social media platforms at OncoFarmPod. And until I talk to you again, remember, doses matter.